Salon with the Smile Doctor. We're here today with Carolyn. Carolyn, thank you for letting us share your video today. We're going to be doing some fillers for the face, and then she's going to do her lift, which is really exciting. How long have you been thinking about having the lift done for?
Oh, at least 5-7 years.
This is so exciting that
yes.
Today is the day. So we are honored to be a part of this with Carolyn, but we're going to start first with the fillers. So I'm going to show you in the mirror. Let's see, did you put the mirror away? Can you grab the mirror for me, please? It looks like you put it away. We will need that. You always need the mirror for fillers to set things up, and I'm going to use my white pencil. Thank you. So, and she's bundling up there. We get you extra bundled up. So we talked about with the Sculptor, we're using the Sculptor and the Bellafill. So the Sculptor, I'm going to build in the cheeks, and I'll use the Bellafill for temple, a little bit in the brow through here. And then we're going to build in the smile line. Some people will talk about that they don't like to inject in the smile line, but you want to build the height of the premaxilla. That maxillary buttress does lose height. When you build that up, it creates more of a youthful proportion. So, and then of course we're going to do the lift. Any questions about our bowls?
No, I'm going to let you do what you need to do.
Very good. And so the rule of the white pencil, if you marked it, we're going to inject it. For my physicians and students that are watching, if you didn't mark it, we're not going to inject it, because sometimes patients may say, well, are you going to do this area? That's why you got to mark it and show them ahead of time so everybody's on the same page. All right, very good. So I'm going to set this over here. And Charlene and Yesenia have everything set up perfectly for me, make it very easy. And so I like to use the Hither cleanse. Carolyn is a teacher. She's retired now, so what level did you teach, Carolyn?
Elementary.
Oh, how sweet.
Yeah.
Those little kids, they're so impressionable. It can be so fun.
Yes.
And they need so much discipline.
40 years.
Wow, that's amazing. Really an honor to know Carolyn. She's such a sweet person. Who's driving you home today, Carolyn?
My best friend, Carol.
Oh, how sweet. Very good. Now, is Carol interested in doing the treatment as well?
Yep, she's going to be next.
She's next. So that's what happens. People come in, their family and friends follow. So you're going to feel buzz, and then pinch on 3. 1, 2, 3. Pinch, little numbing medicine. You feel big pinch, little pinch, not too bad there? How about here? 1, 2, 3, pinch. Small, medium, big pinch, not too bad? So a little bit of numbing. These are the areas where I make my insertion point. 1, 2, 3, pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. So I do like to go. I'm going to set this to the side here. We're wearing our 3M VersaFlow Pappers, buzz and pinch. 1, 2, 3, pinch. I've had my vaccine, but we still want to protect for our patients. 1, 2, 3, pinch. It's a HEPA filter. 1, 2, 3, pinch. We have not hit herd immunity yet, but let's see, maybe by the end of the year if we get there. 1, 2, 3, pinch. There's no restrictions for the vaccine in any of our cosmetic treatments. 1, 2, 3, pinch. Okay, so now that I've done the numbing, I like to start with the Sculptra. And I'm going to make the insertion points because the cannula I use is a blunt tip cannula. So, feel a little bit of a pinch there, not too bad. How about here, a little pinch? And how about here, pinch?
Yeah.
Small, medium, big, not too bad.
Well,
so Carolyn has had a little bit of the Valium. Do you feel the Valium?
yeah.
I feel pretty relaxed too, but I didn't take any Valium.
Good thing.
So a little pinch there. Valium, set that down in there. Okay, very good. So with the Sculptra, I like to mix it right before I start, because it does settle if you let it set for too long. Now, I'm going to turn your head this way nice and easy. I'm going to swap places. You guys need some pressure pinch. Is that your battery? Someone's beeping. Feel a little pressure pinch. You need to step out. You guys can trade places, Charlie. Perfect. So now I'm just putting in a small amount in the orbital rim. Everything's looking good. Carolyn, how you feeling, dear?
Okay.
Perfect.
Lorraine says, I had mine on Tuesday and I love it.
Oh, I'm so glad you like it, Lorraine. Thank you for watching. Thank you for sharing. We're going to turn your head this way. Pressure, pinch, pressure, pinch. Tapping, shiver technique for a small amount of filler over a very large area gives you the best result. Everything's looking good. Thank you for watching. We're on a mission to stop bad plastic surgery, and people are not going to make good choices until they know their options. So that's why we put our videos out there. This is live, unedited, unfiltered. Very good. How are you feeling, Carolyn?
Okay.
So Sculptor is a gradual filler. It takes about 3 to 6 weeks to see a result, but even at 2 months, 4 months, and 6 months, looking at it this way, you see continued improvement. Pressure pinch.
How long does this treatment last?
We have the permanent filler with the Bellafill, and then the Sculptra is a 2 to 4 year filler, but it is a superior collagen stimulator, and it works very well with the Bellafill. Can you give Yesenia help out either one with the dogs, or you can mix the Sculptra with Charlene? Thank you. She's the camera person. Everybody's batteries all set. So it feels numb and goofy under the eyes when you inject, because there's some lidocaine, some numbing medicine. How about here? Do you feel a little pressure pinch or not really? Once it numbs, you really don't feel that much, which is great. And you need to make sure your patients feel comfortable during fillers so you can get your best results. You're not going to get your best result if the patient is uncomfortable or moving a lot. So it breaks my heart to hear patients say they had fillers and it was extremely painful. It's normal to have some pinching, but some patients may need laughing gas, and you can use the nitrous or Valium. If you use Valium, you're going to need a driver. If you use the nitrous, that clears your system very quickly, and you can still drive about 15 minutes later. Get you cleaned up. Everything's looking good. How you feeling, Carolyn?
Good.
Let me turn it this way a little bit. The Sculptra will not overcorrect in the dosing that we're using here. Patients tell me they don't want round faces, but here's a good idea. Look at your photo from high school or in your 20s. You'll see how the volume of your face changes. I am just putting back what was already there. And of course, when we combine that with the tightening, it's going to be a remarkable result. How about there, any pinching or not really? Very good. And turn your head this way. Very good. Now I'm going to use a little bit, so this feels good. Just a tiny bit in the brow. because we do hollow around the eyes. So it's a good idea to put volume there. Now this is an advanced technique. So I saw a patient this week, so they went to a very inexperienced provider and they had significant issues. So they told me, they said, I'll never go to anybody else again. And they said they learned their lesson. You got to get it done the right way. This is an advanced technique to do around the eyes, okay? So don't let anybody do this. I've done over 20,000 syringe of filler injection. People see it and they say, well, I can do that. But they can get into trouble. So we got to keep you safe and do things the right way. That's why we're teaching.
Yeah. I have many student teachers.
Yeah, as a teacher, Carolyn knows about that. Now, the root word of doctor, docere, is to teach. So doctors really are teachers because they teach about health, nutrition, healing. So that's why we're here to teach you how to stop bad plastic surgery, how to do things the right way. Everything's looking good. How's Carolyn feeling?
Good.
Twist, twist, twist to advance the cannula to the place where you want to inject the filler. And then once you inject a little bit of the filler, I call it its hydrodissection. It puts a little bit of volume, and then when you massage that, it opens the subcutaneous space up a little bit, makes it easier for subsequent injection. I'm going to do a little bit in the inframulla because we do lose volume there as well. This is just for balance. So a tiny bit there. Just enough, but not too much. Carolyn has high cheekbones, and so she will be a little bit puffy, but that does settle down before it's done baking.
Miriam Cologne says, I am having sculpture fillers done for my under eye bags. I can't wait.
You're going to love it. It's the best way to avoid a lower eyelid surgery. If you can avoid lower eyelid surgery, that's a big advantage. And most of our patients are happy with the filler without having to do the lower eyelid surgery. Let me turn your head this way a little bit. Pressure pinch. Tapping. I'm just going to put about a half syringe here. Just a small amount. It numbs as we inject. This is the Bella-filled permanent filler. Most patients want the permanent filler. Everybody's a little bit different. Darling, can you grab some gauze for me, please? On this side.
You guys open on Saturday?
Every now and then I will do that. Have some Saturday treatment. And turn your head this way a little bit. Cover the whole temple this time. Pressure pinch, pressure pinch. Everything's looking good.
Carolyn's age?
Say that again, you're saying?
What's Carolyn's age?
Carolyn, can we tell them how young you are?
74.
74 years young. Carolyn has many active years ahead of her yet, so
I hope so.
honored to be a part of her journey. And she's been wanting to do this for 5 years now.
Oh, yeah, at least.
When we look good, makes us feel good, makes us want to do good. That's why we are here, to help you do this the right way. Can you take a look on that side, please? And then can you come on this side and do the same for me, please? Step over here. And we just over the whole temple. I like to hold a little pressure after I inject the temple, just to make sure we reduce any significant swelling. We'll have more of the belly. Turn your head this way a little bit. Good. So now I'm just adding. So now she'll feel very little of what we're doing because I've already numbed it with about half of the syringe.
Wow, she looks great.
She really does look good, but it's going to get better because we're going to do the lift all under local anesthesia, the safest way to do a lift. Perfect.
Do you need to
Put a little
call
pressure on this side.
in early for a Saturday appointment?
Yeah.
So for right now, see Charlene, so you gotta really hold some pressure there, okay? Everything's looking good.
I trust you.
Everything. Everything. Good. 1, 2, 3. And turn your head this way a little bit. Good. So when you're doing the fillers, I like to ask patients to do a 5-minute massage 5 times a day for 5 days. You can't hurt the product. I'm going to turn your head a little bit more this way. Perfect. Everything's looking good. Bellafill is made up of 80% collagen and 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen. The PMMA is permanent and is non-absorbable. Perfect. Very good. So I'm going to come on this side. So I want you to cover, hold on here, because I want you to see that whole area as well. So it's really important that you cover that area. Go ahead. Now here, yeah, with the thumb. That's perfect. Very good. So I like to hold some pressure on the temple. Now I'm going to do some in the smile lines. And Carolyn is a big smiler.
Yeah.
And of course, there's nothing that we do to the face that looks more attractive than our smile. Let me turn your head this way a little bit. So now we're going to do a little bit in what we call the medial-labial fold. Little fill. You feel a little pinch, big pinch, not too bad. When you let you know I'm not in a hurry. And this is a common area that we lose volume. I'm going to turn your head this way a little bit more. Perfect. So right there in the corner of the mouth, you get that downturn. Sometimes I'll even put a little Botox there. It just depends. But Botox does a good job around the mouth, the glabella, between the eyebrows, the forehead, crow's feet, and I'll even do some in the platysma. There's a little platysma band showing. So I think it is important to build up that premaxillary anterior projection, and the vertical maxillary buttress, that's right in this area, loses its anterior projection. So we're just building that up. Even though you're not going to get rid of the nasolabial fold, it deepens every time you smile. It is a good practice to put volume there. That is my opinion. And that's what we call our masterpiece technique.
So for the appointments and schedules, you could
Say
contact
that real loud.
you could contact our office.
Hey, give us a call, 813, I'll tell you this from 813-463-9245. Thank you, that's good. And turn your head this way a little bit. And then Charlene, I'll have you stand on that side.
Okay.
You need something? Can you stand over here now? Okay. You stand over here on the side, Charlene. And then I want you to hold pressure from this side, from the top. Good. Just like that. Thank you. Very good. So a little bit in the nasolabial fold first. Perfect. Pressure, massage. How are you feeling, Carolyn? It's looking really good. Very excited for her before and afters. And I like to do a little bit in what we call the pre-gel sulcus. Very good. So we are done with the sculpture, and that's 4 Bellafill. And so what I'm going to do now I like to do a little bit of massage right here through the cheeks, around the mouth, around the smile lines, release for a moment on the temples. Yes, that's very good. We get a little bit of swelling there. And Charlene, can you bring the computer over with the photos so you can see that? Now I want you to open up your eyes for me. So you see from where we started the hollows and around the smile line, so those areas have softened, a little volume in the temples, but there's still some swelling. We don't want to taste the chocolate cake before it's done baking. So we're going to get started with the lift. You did great with the fillers. That wasn't too bad, was it? Okay.
So it is Sculpture and it is Bellafill that he did.
Sculpture and Bellafill is what we did. So we'll see you in the next video. We're on a mission to stop bad plastic surgery. I'm Dr. Rich Castellano here to help you raise your cosmetic standards. We'll see you in the next video. Stay tuned and like and follow because we will have more videos coming soon. You did great. Congratulations.